Two cases of Ebola have been declared in the Democratic Republic of Congo, adding to fears about the deadly virus. However, officials there say this is a different strain of the virus and not the same one which has killed more than 1,400 people across West Africa. Meanwhile, in Liberia, a doctor who received an experimental Ebola drug has died. For more on the cases and the fight to contain the outbreak, I spoke a short time ago to Dr. Adalja. He's a physician and expert in infectious diseases at the University of Pittsburgh Medical Center. Dr. Adalja, thank you very much indeed for coming in. Why are we seeing these new strains of Ebola cropping up?
So the recent announcement of the new strains in the DRC really aren't so new. We know that there's been many species of Ebola identified, about 5 different species of the Ebola virus. And what we're seeing in the DRC is a strain distinct from the one causing the problem in West Africa now. But what's unique about it is it's a combination of 2 strains that we had seen before. The Zaire strain and the Sudan strain kind of combined together to infect an individual. We don't have a lot of information yet at this time, but I think more will come out and we'll see that this is a natural event that occurred between the 2 strains of the virus kind of changing. They may have swapped some genes and now infected some individuals in the DRC.
There seemed to be a bit of confusion over whether or not this was in fact Ebola. How difficult are they to identify, and does it make treatment more difficult?
When someone comes to a health clinic in a resource-poor country or an area where Ebola is endemic, there's a lot of overlap between the symptoms of Ebola and things like malaria, things like some other hemorrhagic fever viruses like Lassa fever. So it's very hard as a clinical person to be able to make the definitive diagnosis without backup lab testing. So that becomes difficult. So to diagnose Ebola, you really need to have a lab test, and that has to be sent to a place that's capable of doing the test. And that may take a couple days to get a result back. So that often delays recognition of an Ebola outbreak because of the overlap with things that are more common like malaria.
Now, in the context of what's happening in the rest of the continent, how worrying is the emergence of Ebola in the Democratic Republic of Congo?
I would say it's less worrying than the emergence in West Africa, and that's because the DRC is pretty adept at dealing with Ebola outbreaks. They've had multiple Ebola outbreaks over the years and have stopped every one of them using very low-tech approaches that work in Ebola outbreaks. The other thing is that these cases are isolated in a remote area, which is usually more typical for Ebola to be in these remote areas rather than in urban areas. So that limits spread because the number of people that an individual infected with Ebola can contact and spread the virus to is much more limited in these types of settings than in an urban environment.
Now, what about experimental drugs? There has been a lot of debate over whether or not they should be used. A doctor in Liberia has died in spite of being treated with the same drug that was used for 2 American doctors who lived. Given that, should these drugs be more widely available when we don't really know whether or not they work?
I think that's the important part. We don't really know whether they work because they're not being administered in a randomized controlled trial in a way that actually proves that they're effective. And there are a lot of issues with giving drugs that really don't have any safety data in humans. Now, I don't think that individuals that are dying that are getting the ZMapp product necessarily can attribute that to the ZMapp, but maybe that they're so far along in the course of illness that no treatment will actually work. But it's important to find out what the window is that we can use these drugs. And I don't think that people should hold out hoping that these drugs are going to stop the current outbreak in West Africa because they are not going to be available in quantities sufficient enough to even make a dent in this outbreak.
Dr. Adalja, thank you very much indeed for joining us.
Thanks.